Did you know that over 1 billion people worldwide are vitamin D deficient, many without even knowing it? From weak bones to depression and chronic fatigue, the sunshine vitamin plays a role in almost every part of your health. But how much do you really know about it? Let's decode vitamin D once and for all. This video will change how you view sunlight, supplements, and your health. What is vitamin D? Vitamin D is not just a vitamin. It acts more like a hormone in your body. It's fat-soluble, meaning it gets stored in your fat tissues and liver. Two main forms: D2 ergocalciferol from plant sources, calciferol from sunlight and animal sources. D3 is more effective at raising and maintaining vitamin D levels. How vitamin D works in the body. Skin makes vitamin D3 when exposed to UVB rays. It travels to the liver, then to the kidneys where it becomes the active form. Calcitriol, 1,25-dihydroxyvitamin D. Calcitriol regulates calcium absorption, bone strength, and immune response. Also affects muscle function, mood, and inflammation. How does vitamin D work in the body? Let's geek out a bit. Vitamin D is synthesized in the skin, converted in the liver to 25-OH-D, activated in the kidneys into 1,25-H2D calcitriol. This active form then talks to your DNA, regulates genes, strengthens the immune response. Why vitamin D is so important? 1. Bone health. Helps absorb calcium and phosphorus. 2. Immune system. Enhances pathogen defense, reduces inflammation. Mood regulation. Linked to serotonin levels. Deficiency tied to depression. Muscle strength. Prevents muscle weakness and falls. 5. Chronic disease protection. Reduces risk of heart disease, type 2 diabetes, MS, and even some cancers. Symptoms of vitamin D deficiency: fatigue, tiredness, frequent infections, bone and back pain, depression or low mood, hair loss, muscle pain or weakness, slow wound healing. Long-term deficiency can lead to rickets in children, osteomalacia, osteoporosis in adults, compromised immunity. Causes of vitamin D deficiency. 1. Lack of sunlight, most common. 2. Darker skin, melanin reduces synthesis. 3. Older adults produce less vitamin D. 4. Obesity, fat traps vitamin D. 3. Kidney, liver diseases, impairs conversion. 6. Certain medications, steroids, anticonvulsants. 7. Malabsorption, Crohn's, celiac, gastric bypass. Sources of vitamin D. Sunlight. 10-30 mins of midday sun, arms, face, legs. Darker skin, more time needed. Sunscreen blocks production, balance is key. Food sources: fatty fish, salmon, sardines, tuna, egg yolks. Fortified foods, milk, orange juice, cereals. Mushrooms, especially UV exposed. Supplements: vitamin D3 is preferred over D2. Check with a doctor before starting high doses. Recommended daily intake plus testing. Infants, 0-12 months, 400 IU. Children, 1-18. Years, 600. 1,000 IU. Adults, 600-2,000 IU. Elderly or deficient, up to 4,000 IU, safe upper limit. Testing: blood test, 25-hydroxyvitamin D. Optimal range, 30-50 nmol. Maldeficiency, 20-30 ml. Severe deficiency, 20 ml. Toxicity, 100 ml. Myths about vitamin D. You don't need supplements if you eat well. False. Hard to get enough from food alone. 2. Any sun exposure is bad. False. Moderation is key. 3. Only old people get deficiency. False. It affects all ages. More is always better. False. Vitamin D toxicity is rare but dangerous. Can you get too much vitamin D?
Toxicity occurs with very high doses.
10,000 IU day for long periods. Symptoms: nausea, vomiting, kidney stones. High calcium levels. Confusion? Always supplement under medical guidance? Vitamin D is a small nutrient with a huge impact. From stronger bones to a sharper immune system, it's worth checking your levels and making sure you're not running on empty. Like and subscribe. Hit the bell for more science-backed health tips. Comment: have you checked your vitamin D levels recently?